So good afternoon to everyone. My name is Leonardo McClarty, and I'm the president of the Howard County Chamber, and it's my pleasure again to come to you with another fantastic panel as we talk about preparing to open issues and get ready to go back to our respective offices physically over the next several weeks and actually I hate to say this month, but with that, we've been spending the last couple of weeks talking about a number of issues that business owners and managers will have to be aware of over the next several days and weeks, and things that they should be addressing, again, within their respective businesses and places of employment. And so we started out talking about liability concerns and liability issues. We shifted gears and talked about facilities management. And today we're going to move into the area of behavioral and mental health. And so again, we've got a great group that have been assembled here with a lot of expertise. And so I am going to get started with introducing them. Just a few housekeeping issues. I'm going to ask everyone, if you have particular questions, if you would use the actual question and answer feature as opposed to the chat line. It makes it easier for us to follow the questions being asked, as well as also to know if we've covered them both verbally or if it's something where we can just type an answer and we can continue to move forward. But certainly I do encourage you to ask questions of this group. Again, we've got a lot of really good resources available right now. Also want to just acknowledge and thank our annual partners of the Chamber, who many of you see their logos behind me. And so I may move my head over just a bit so you can see all of them, but we definitely want to acknowledge our annual partners, the companies and businesses that have certainly supported the Chamber this year. And truly without them, we certainly wouldn't make it as far as we've made it to date. And so with that, I am going to proceed in introducing our group of panelists. And so we're going to start out with Shireen Cabrera Bentley, and she is a licensed certified social worker in the clinical realm with approximately 20 years experience in the field of behavioral health treatment. For the past 16 years, she's been employed at the Howard County Health Department, assisting individuals and families with their various needs, as well as offering guidance and technical assistance to the publicly funded providers in the county. She currently serves as the Deputy Director for the Bureau of Behavioral Health, where she remains eager and committed towards continuing this work for the benefit of the greater community. So Shireen, thank you for joining us today.
Thank you for having me.
Next, we have Dr. Ro Rogers Bonacorsi, and she is the Director in the Bureau of Behavioral Health at Howard County Health Department. She has 25 years of experience working in the behavioral health field, including work in health departments, nonprofit agencies, school settings, and private practice. She graduated with a PhD in counselor education from the University of Maryland, College Park in 2010. She has also graduated with an MS in rehabilitation counseling, specializing in substance abuse counseling in 1995 from Southern Illinois University in Carbondale. She holds the following state and national licenses and certifications. She's a licensed clinical alcohol and drug counselor. She's a licensed clinical professional counselor, a certified rehabilitation counselor, and national certified counselor. So again, Dr. Rogers Bonacorsi, thank you for joining us as well.
Thank you.
And then now we move to the two men. We have Dr. George Kolodner, and he is the designer of the first intensive outpatient addiction treatment program in the country. And for over 40 years, he has served the people of Maryland and the District of Columbia area. Dr. Kolodner specializes in the ambulatory treatment of substance use disorders. Currently, he serves as the Medical Director and Chief Innovation Officer for Colmac Outpatient Recovery Centers. Their outpatient services include detoxification, medication-assisted treatment, rehabilitation, and continuing care for patients with and without other co-occurring psychiatric disorders. In addition to his work at Colmac, Dr. Kolodner serves as a clinical professor of psychiatry at both the University of Medicine and Georgetown University. He was the lead author of the withdrawal management chapter of the ASAM criteria. And Dr. Kolodner has a medical degree from the University of Rochester and completed his psychiatric residency at Yale University. And so again, we thank Dr. Kolodner for joining us as well, and just providing support to Dr. Kolodner is Jennifer McCann, also with Colmac. And lastly, we have John McNally, and he is an assistant administrator in the Department of Psychiatry, and Behavioral Sciences at Johns Hopkins University School of Medicine. In this role, John is responsible for clinical operations, finance, and human resources for the Community Hospital Division of the department, which includes Howard County General Hospital in Columbia, Sibley Memorial Hospital in Washington, D.C., and Suburban Hospital in Bethesda. As part of his role, John is responsible for the daily operations of 2 outpatient psychiatry practices, one in the Medical Pavilion at Howard County and one at Sibley Memorial Hospital. Each practice offers medication management and psychotherapy for patients. So again, thank you again to all of our panelists, and we'll certainly get started with the questions here. And so, but first, I'll kind of, I guess, set us up. And so the COVID-19 pandemic and resulting economic downturn has negatively affected many people's mental health and created barriers for people already suffering from mental illness and substance use disorders. In a recent Kaiser Family Foundation poll, nearly half, or 45%, of adults in the United States reported that their mental health has been negatively impacted due to worry and stress over the virus. As the pandemic wears on, it is likely the mental health burden will increase as measures taken to slow the spread of the virus, such as social distancing, business and school closures, and shelter-in-place orders, have led to a greater isolation and potential financial distress. And though it's been necessary to prevent loss of life due to COVID-19, these public health measures expose many people to experiencing situations that are linked to poor mental health outcomes, such as isolation and job loss. So additionally, feelings of anxiety are increasingly common as people are fearful of themselves or loved ones falling ill and are uncertain of the repercussions of the pandemic. And so with that being said, we're going to start with all of you asking the same question. And that being, as a result of COVID-19, as we've just heard, and people's working remotely and social distancing for the last couple of months, what impact are you seeing? What impact are you seeing on the public's mental state and behavior, particularly those that you come into contact with directly? And so I'm going to start with Shireen.
Okay, good afternoon. Thank you. One of the things that I will say, speaking from the health department's perspective, is that we have definitely been outreached to from not just consumers, but residents and providers of the county seeking resources, any helpful tips that we could provide that would help the public better cope with the drastic change that we've all experienced in becoming socially isolated. So we've definitely been hearing from the public at large via phone calls, through our website, through Ask Health. They've been making their feelings known to us that there is a need for information and ways to cope. And so what we have done, we've been very intentional about putting forth messaging on social media and across our various platforms, such as YouTube and the website, on helpful tips that folk can utilize during this time. So that's one of the ways we've been sending out messaging on topics related to coping with anxiety, on dealing with any stress related to COVID-19, on self-care tips, We've hosted also a variety of webinars for not just the public providers, but also some Facebook Live events and other, we have some upcoming Instagram Lives and other modes that we're going to be utilizing to make sure that we continue to provide information to the public so that they can continue to navigate this change. So we have been getting feedback, and so we've tailored our response to make sure that they're aware. We also maintain an up-to-date list on our website of providers that folk can reach that will provide telemedicine services, whether it be in this format that we're utilizing, such as Zoom or Skype or any other type of web format, to be able to make sure that they maintain some sort of connection as we navigate this new normal.
And Dr. Bonacorsi? Same question.
Hi, good afternoon. Thank you.
Yes.
Yes, I agree with Shireen. We have received lots of referral calls asking for calls and emails and referral forms asking for referrals from a variety of sources. Most of our work is doing that, linking people to care. So in our role as the local behavioral health authority at the health department, we're not providing direct care per se. We do provide some grant funded direct care, but we're not providing billable care like COMAC would provide or the hospital would provide. Our main role for that is referring the consumers and the family members out to those referral sources for direct care. So we're looking at whether it's a substance primary or a mental health primary or both. Oftentimes it's co-occurring, so it could be both. We're looking to see what their needs are, what providers we are aware of that have those services, what their insurance provider coverage would include. You know, for instance, if that provider doesn't accept Medicaid and that client has Medicaid, we would be looking for a Medicaid provider, or vice versa, a private insured provider to take on that referral. So we provide behavioral health navigation services. The hospital also has some positions for that as well, and grassroots crisis intervention as well. So we work closely with grassroots crisis intervention, and we partially fund some of their services to provide that service. So if anyone's looking for urgent crisis care, they can call 211. That's the best way and quickest and easiest way to remember, 211. And then once you get to that line, you press 1 for behavioral health resources. And Grassroots is one of the agencies that answers that phone line. Oftentimes people think 211 is a statewide service, which it is, but however, Grassroots is a local Howard County provider that answers that phone line. So I'll stop there for now.
Okay, all right, thank you. And Dr. Kolodner, I know that COMAC has been quite busy. Tell me, what impact are you guys seeing?
Well, I'll start with the bad news and then move to the good news. The bad news for our folks, so again, we're an outpatient treatment program that focuses primarily on employed people with alcohol and drug problems. And when people come into treatment, they typically have gotten to the point that they have self-isolated into their homes. They've cut off from other people, and their alcohol and drug use intensifies. Part of treatment is getting people out of that setting, getting them, breaking down their isolation, getting them out mixing with people, and a lot of recovery has to do with relationships. The bad news is that because of the lockdown, a lot of our patients are being forced back into the very setting that was associated with heavy use. So they are finding themselves increasingly strained to maintain their recovery. So they're at the very least more anxious. And worse than that, we've been seeing more relapses. Uh, the, on the other hand, the people who were already in our program have stayed in our program. But the other bad news is our number of inquiries for treatment have plummeted. They're starting to come back now, but they plummeted at a time that we know statistically that liquor sales are up. We don't know about the drug sales. So I'm assuming that these folks have gone, people who ordinarily come out for treatment are now in there drinking and drugging. And I think that we're probably going to see an upsurge of people looking for treatment when this is all over. So that's the bad news. The good news is that there have been for some years now evidence that telepsychiatry, telemedicine, telehealth services were quite effective. But when it came to outpatient rehab, alcohol and drug rehab, it's been extremely limited because not that the technology was there, the clinical knowledge was there, but there was a web of federal, state regulations that really hadn't caught up with the technology and were making it pretty much impossible to do, as it was with insurance restrictions, because all of our patients have commercial insurance, and the commercial insurance companies were not covering these services. Well, within a week of the lockdown, all of those things were relaxed. These are regulations that people have been working on for years with very little progress, and they were put aside, hopefully permanently, but one of my fears is they're going to come back. And with that being put aside, we've been able to transition all of our programs into a virtual setting, and our outcomes at this point are roughly equivalent to what we were having on site. So that's the good news.
Excellent. And so, John, last same question to get us started. And obviously, you're at the hospital, so tell us what are you seeing from the hospital's perspective in terms of the impact, on the public's mental state and behavior.
Yeah, so I mean, a couple things. I'll break it into. I also oversee the ER service here at Howard County, which is a crisis service that we staff with licensed clinical social workers. So I'll start there. When the order came out about shelter in place, stay at home, which I think was back on Monday, the 30th of March at 8 p.m. What we saw from the perspective of the ER service is really a significant drop in volume. And, I don't think it's that people didn't have mental health concerns then, and certainly towards, throughout the month of April, like the volumes were significantly down. This has historically been a very busy service. We get, all the emergency petitions in Howard County, people being brought on by the police. We have people self-present. So there's a significant adult and pediatric volume, more on the adult side. So for the month of April, the volumes were very down. And I think people are scared. Not just because of community transmission of COVID-19, but frankly, I'm coming to the hospital, which is where, patients under investigation are coming, or positive cases. So I think people were frankly scared to come to the hospital. Towards the beginning of this month, we've seen that volume coming up. It's still not to where it was. I would say at this point it's steady, but people I think are coming back to treatment, or realizing, hey, I need some help, and we're either connecting them to that help in an inpatient admission, or connecting them to outpatient services. So that's what I would say kind of on that side. And then when you look at our outpatient practice, Our patients embraced the telehealth model relatively well, but what we're starting to see now is we're starting to see patients ask to come back to the practice. And most, I think, providers, whether they be private or larger health systems, are developing a plan for how can we do that safely. And I think we're going for people to feel comfortable. Some will be more comfortable than others, but I think it will be important that every practice say, what are we doing to keep people safe? Most places, I think, will require everybody to wear a mask, staff and patients. Most practices will wipe down, commonly touched surfaces. We're actually going to do that in our practice, and we're not going to have cleaning staff. We're actually going to have providers, wiping down their office in between each patient, spacing the patients out, things like that. But we're starting to hear now that the patients want to come back to practice because I think that people want to feel a sense of belonging. And I think the isolating is particularly hard for this population, but just anyone in general, 6 weeks of being at home, not being around your coworkers, things like that, not being able to go out and do the things we're used to normally doing, I think is, affecting people. I think it was good that we are now under a safer at home health advisory and that people can at least get out and do some things, because I think, we're social beings and we all want that sense of belonging and that we're a part of something. So, those are my thoughts and what I'm seeing.
Yeah. And that, I think, is really a great segue into kind of our first question. And this, well, really maybe not our first question, but our second question, which really goes to both Shireen and Dr. Bonaccorsi. And that is, so since we've had the stay-at-home orders, slowly start to become lifted and, and we're, and now we're living and working under a safer, I guess, at home order. What should employers and employees be aware of specific to behavioral health concerns?
So I'll take this question. As you said, we are transitioning from that stay at home to a less restrictive, safer at home approach. Some of the individuals may be experiencing stress and anxiety around returning to the workplace and returning back out into society. Fear, anxiety related to possibly contracting COVID-19 can be very overwhelming. They could be anxious, depressed, burnout, reduced productivity could result. We have to make sure we know how to cope, or we have skills and mechanisms in place to cope. Some of these symptoms that we should look for in ourselves or in employers look for in their employees. It could be experiencing irritability, anger, denial, uncertainty, anxiousness, nervousness, lack of motivation, tired, overwhelmed, burnout, sad, depressed, difficulty sleeping, difficulty concentrating, are all some factors to be looking for in ourselves and others. We want to make sure that we have tips in place and ways to cope with that stress and anxiety, to build resiliency for ourselves and for others around us. So we should stay connected, communicating with each other. There's various ways. I know we're reducing our contact with people right now, but however, we still can communicate with people through platforms like this, through online mechanisms, through phone. So make sure we're talking with each other, figuring out what's causing our stress and our anxiety and how we can help resolve that. If it's related to the workplace, what are some additional impacts that COVID-19 could be impacting that person in their workplace? Take breaks from work, take a stretch break, take some extra time to exercise, check in with others, go outside. I've personally found it's been very helpful to take a break, 5 minutes at least, go outside, get some fresh air. What I've been doing is walking outside. If I only had a few minutes, I do some pacing outside on the sidewalk. After work, I go outside for a walk every day if I can manage. We should stay informed about COVID-19 to help protect ourselves and others. But I do want to mention maybe take some time away from watching, reading, and listening to the news stories, because sometimes if we overwhelm ourselves with all the news about COVID-19, we can then further be more anxious and stressed. We can practice mindfulness techniques like deep breathing, meditation, etc. If people if themselves or others feel that they could be misusing alcohol and drugs, and that could include prescription drugs as a means to cope with that anxiety, make sure we're reaching out for help. If people or themselves or others feel that they're anxious or depressed, again, reach out for help. There are people out there that can help support you. Reaching out for help could be as simple as asking a friend or a relative, or if a pastor or a preacher or a more professional audience, a counselor or a therapist. If people are looking for resources for referrals, they can contact us at 410-313-6202, or if they can go on the web to look for more information, howardcountymd.gov/get-help. And then earlier I mentioned the 211 press 1 for the crisis hotline, or they can call Grassroots Crisis Hotline. It's a 24/7 crisis hotline, and that's 410-531-6677. 410-531-6677. So I'll stop there for now.
Thank you. And it's interesting that you mentioned about the taking a break and going out, because certainly I think as people that I've spoken to, I think we all have experienced that we're working harder and in many respects working longer being at home, that it's been difficult to strike that balance between when to turn it off, because you don't have that fine line of I'm leaving the office, I'm getting in my car, and I'm driving somewhere. Whereas if anything, you are going from the bedroom to the home office, or maybe it's the kitchen table, or what have you. And so it really becomes difficult to separate. And I think the other piece you mentioned that also, I know I found myself even experiencing at times, between wanting to stay informed, but yet also saying, you know what, I got to stop reading this stuff because I need some positivity. I've kind of said at times that, the news will report on how many people have died. Well, how about reporting on how many people have lived? Right. And I think that certainly gives a different perspective. And so, Shireen, you touched on this a little bit earlier in the beginning remarks about just some of the resources and ways that you've been trying to communicate. And so talk about, again, maybe how you are keeping the public informed regarding behavioral health, mental health, substance abuse resources that are afforded to them. I know we've just put the phone number for Howard County Health Department, as well as for the Grassroots Crisis Intervention Center. But if you could also just touch on some of those other places, if people don't want to call, that may be online or what have you.
Sure.
Shireen, if you want me to take that question, because I have a list of items in front of me, and if I miss something, you could jump in. Would that be helpful?
Sure, I went ahead and I put our information into the chat box. Thank you for acknowledging that.
Thank you.
If you miss anything, sure, Ro, I can jump in.
Okay. All right. So I'll make sure I have my mute off. My mute's off. Okay.
I can hear you. Yep.
We've remained open. However, as many, we are teleworking. Most of us are teleworking. So we have been utilizing social media messaging more so now than ever before. And we were promoting behavioral health, mental health, substance use disorder, awareness in relation to COVID-19. I mentioned the website earlier, but Shireen, if you could put that in the chat box. We have developed a list of behavioral health providers offering telehealth. However, most are currently doing that now. We have a list of behavioral health providers that are willing to offer services for free. So if you are looking for free service, we have a small list of providers willing to provide some limited services for free. We've developed a frequently asked questions for the public related to behavioral health and COVID-19. We have developed a frequently asked questions for behavioral health providers related to behavioral health and COVID-19. And we are currently creating We Are Here For You video clips. They're brief, couple-minute video clips that are promoting some of our Bureau of Behavioral Health Services here at the Howard County Health Department. The 3 videos we have that are finished and out on YouTube right now, on the Health Department's YouTube channel. We have a video on peer support. We have one on foreign-born outreach. And we also have foreign-born outreaches and related to mental health outreach for those clients who might not have insurance or have limited income and needing a referral and funding for that appointment. We can provide for the mental health counseling and also for prescriptions if needed. And then also our overdose response program. So those 3 videos are out right now on the Health Department's YouTube channel, and they're also a link on our website if you want to go there to look for them. We're working on additional videos, one of the foreign-born outreach in Spanish, because most of the clients we're working with may be speaking Spanish or other languages, so we're working on that in Spanish, and also a psychogeriatric video clip is to come. We also have been having weekly behavioral health provider COVID-19 resource response webinars since the end of March through the end of May. So for 2 months, we've had weekly webinar calls, and I'll go down a quick list of some of those calls and the content of them. We had, the first one was on telehealth, because that was very fitting. People on a stay-at-home order and agencies providing service through telehealth. So the first one was on telehealth and COVID-19. Next on self-care, suicide prevention, medication-assisted treatment, and telehealth. And COMAC was there with us. Dr. Klodner was there as one of the presenters. The next one was on foreign-born and special populations in COVID-19, vulnerable populations, homeless and detention center clients. The next was stages of trauma and recovery. And that one was open to the public, and we had 94 people attend. So we had a good showing of that one, stages of trauma and recovery. And also we had one on cultural competency related to COVID-19, vulnerable populations, children and families, vulnerable populations, veterans and caregivers. So the one coming up, let's see. Yeah, the last one we have scheduled is on Wednesday, the 27th, which is veterans and caregivers. And that is on a Wednesday at 11:30. All of those that have already happened have been recorded and are on the website. If you'd like to review them, you could go to hclhic.org, and that acronym is Howard, stands for Howard County Local Health Improvement Coalition. So that's hclhic.org. You can find those recordings. Also, we've been working on distributing Narcan. Narcan is a medication to reverse opioid overdoses to various providers, treatment facilities, recovery housing centers, residential treatment centers, etc., that would have clients continuing to come in their doors during the COVID crisis. So we're distributing Narcan more so now than we had in the past. Since the COVID-19 pandemic in the last couple months, we've distributed 1,400 doses of Narcan. We also are distributing Deterra bags. Deterra bags are medication disposal bags, which is very important now when we were on the stay-at-home order. Now we're on a safer-at-home order. people are in their homes more often, children, teenagers, anyone for that matter would be in the homes, and medications could be laying around. Most importantly would be some of the addictive medications, opioid medications could be laying around. People could pick them up, use them, etc. So the doTERRA bags we felt was important to distribute out into the community during this time. So we've been working with food pantries, meal distribution sites, and other agencies to distribute those bags. We've distributed 300 bags so far, and we're working to distribute 2,000 more. And if you're interested in a bag or getting some, let us know and we can see about getting those to you. Also, Shireen mentioned about webinars. We already talked about video clips, social media. We've had 2 so far Facebook Live events, actually one at noontime today. Dr. Doty was providing a Facebook Live event. She was providing that through a contract with us at Howard County Health Department. And also last Wednesday or last Thursday, I think, 14th, we had one at noon. Julie Murray through Inquiring Minds and Colleen Nestor within the health department provided a live Facebook event regarding mental health and COVID-19, and that was through a contract with the health department. Video clips, more additional video clips. Julie Murray through Inquiring Minds through a contract with us has created 6 different video clips that can be found on the health department's YouTube channel. Most of those 6, I think 4 or 5 of the 6 videos are already up, but if they're not all up, we have more to come on that. I think that's a pretty good list for what we're doing.
I think so. Certainly, you guys are quite busy to say the least, and I think probably from there we're going to end up, I think, being able to really use that as a shifting point to both Dr. Kolodner as well as to John, with first starting with Dr. Kolodner. And so with many organizations, obviously having a remote workforce over these last, couple of months, and quite honestly, even as we go through the summer with changes in childcare situations and so forth, we'll probably continue to be working remote. What are some signs and symptoms that an employer may notice of an employee, particularly with maybe potential alcohol or substance abuse, I guess, that they may see in a remote environment, considering that you're not running into this person every day in the office, at the water cooler, in the conference room, et cetera?
Well, it certainly starts with a difficult question, because even in an on-site setting, finding signs and symptoms of alcohol and drugs problems are not easy for a number of reasons. One is that folks who have these problems, for the most part, are, number one, have some awareness, even if they don't acknowledge it's a problem, they have some awareness that use in work settings is not appropriate. And at the same time, their being in the work setting is very important to maintain their livelihood. So they work very hard to cover that. And my experience is that they're very good at covering it. And it's not until the really later stages that it becomes apparent. And what becomes apparent first is some decrease in performance. So classically, you have somebody who's been a very good employee and for a period of time, and now they're not up to their usual standards. That's a very general, generic symptom, if you will, or sign. There are many things that can cause that, and that's why many work sites have employee assistance people who are there to do an individual assessment and see which of the various possible personal reasons can be causing this. And alcohol and drug use is one of them. So decreased performance in their work would be one thing. The other is a change in people's attendance or tardiness. So people start missing or start coming late, especially if that hasn't been a problem. Those are the kind of rather gross measures that you would look at. Actual intoxication or withdrawal would be extremely late stage. People with alcohol and drug problems have a very high tolerance, and they work very hard to stay within their tolerance. So even if they have a very high blood alcohol level, you wouldn't know it. They're clinically invisible because they've learned to manage that. And certainly the smell of alcohol in somebody's breath is not something that's going to show up in a remote forest. Because of the high tolerance of these people, even though alcohol leaves the body very quickly, some of these people get to the point of drinking themselves to sleep at night, and it takes so much to get themselves to sleep that when they get up the next day and go to work, even though they don't drink before they go to work, they still have residual alcohol left in their system, and so that can be noticed by coworkers. But that's not something that we're going to be seeing in this setting. In fact, the only way that we, even though we're clinicians, are unable to identify a lot of our people who are using alcohol and drugs, even though we're trained to work with them. And so we typically use breathalyzers to identify people with blood alcohol levels, even though we can't see it. And we lean heavily on urine testing. One of the things that we have maintained in a non-virtual setting is the urine testing. So all of our sites now have the capacity to do that, and an important part of our program is to have people come in and do urine testing. There are, I think, some work sites that have done that as a condition for people to return to work. And I don't know if they have stood those up to monitor people. Probably not practical, but that would be very, very useful. The other thing that we've been doing, there are some inexpensive breathalyzers that you can get in a pharmacy. And on our on-screen work, we've been having people blow into the breathalyzers and show on the screen that there's zero. That would be another way of monitoring someone in a work setting if you were already monitoring them in person. That's my answer.
Excellent. Well, that's again very helpful, and I think that last piece you touched on. I think maybe with some of the EAPs and so forth, and maybe this, John. So one of the things that we've talked about and that we've heard both, particularly from the health department, has been around resiliency and stress management and so forth. So maybe what are some things that employers can do to help with employer resiliency, just in a general sense, and maybe talk a little bit also about perhaps EAP programs as well?
Okay, yeah. So, we've brought up the topic of mindfulness, and that's, I think a topic that there's a lot of information out there that people can have ready access to. It's all really about being in the present and, bringing yourself to, without going into all the details, focus on your breath and be in the moment and be present and, not let your mind wander and worry about all sorts of different things. It's been proven to improve productivity and satisfaction with work and prevent burnout and things like that. So it's certainly something that employers should be aware of. Employers should be promoting their EAPs more now than ever. Many, if not all, are confidential. And what a lot of these programs will do is they will, do a triage and can provide some, I think, limited care for free. And then, of course, an appropriate referral where you can get, more ongoing care. I think in addition to that, as leaders, one thing that I've noticed with our leadership at, well above my pay grade at the VP level and entity leadership level is, daily emails from, the leader about the state of affairs. Obviously it's a little bit different in a large institution like Hopkins because we're talking about things like, well, how many cases do we have? And, you brought up a good point. The media is talking about, how many deaths, but we're also learning about how many people have beat this. And I think, frankly, there's more people that have beat it than have died. So I don't want to say that to minimize the loss of life because that's certainly a tragedy. But I think, for businesses, whatever email you can send, I like to think of it as like a shot in the arm. Like, let's get staff motivated. Let's bring things out in the open. Let's have an open dialogue. So I think that's something that people can do. I agree with everything that's been stated. We can't necessarily have a staff meeting, but like, let's talk to each other, or, we can be out in the break room or something as long as we're 6 feet apart with our masks on. And I think it's, to the extent that we can do all those things, we have a lot of different, it takes many shapes at Hopkins because, we have people on the front lines caring for these patients. So, you want to tailor whatever response you have on the employer level to what is the actual need. And that could be individual or that could be team, and different things like that. And, it's going to be different for every single business. And in, like, for the businesses like in Howard County that are, say, daycare centers, something that they're going to have to think about is like, oh, well, how are we going to keep the parents, confident that we're caring for their child, and how are we going to keep the kids safe, and how are we going to keep each other safe? And, so I think, the response has to take many different forms. But I think communication from leaders helps. And I think people, I stated earlier about this sense of belonging and being a part of something. And, it's great when somebody sends out an email and you can read and, like I said, you tailor it to your business, or, you just have an open dialogue. Like, how are you guys feeling about things today? And, be willing to like receive that and, say, well, how can we make people feel safer here? Or, what can we do? So, that's what I think will help people.
Yeah. And so with I'm gonna we're gonna kind of work our way back around as we've got about 11 minutes left. And on that same note, you were just touching on in terms of businesses and particular leadership being in communication with their employees and so forth. And so that's certainly kind of big picture, that communication. But maybe what are some, maybe just briefly, a few ways that businesses can also demonstrate to their employees that they're supportive of them as they perhaps deal with some of these mental or behavioral concerns. So particularly after it's been identified, not necessarily that it was bad, but just if we're having a conversation that, hey, boss, I'm having some trouble, or I need some help, or I'm getting help. But how can businesses perhaps just be supportive so that truly the employee can feel safe that as they deal with these personal concerns that the job is there or the company is still supportive of them? And so, John, if you touch on that.
One thing that I think would help is navigating the healthcare system can be very challenging, and knowing which providers take your insurance, I think can be challenging. And so I think making use of the health department's resources, because they've compiled a list of that, would certainly help people. And, you know, we've stated on the chat here today which insurances our individual practices take. But, you know, you can also call your insurance company, you know, the Blue Cross of the world or Aetna, and they'll give you a listing. So I think it's important that, you know, to the extent, yeah, some employee can call on the phone and get all that information themselves. Don't get me wrong, that's absolutely. But I think that if we as the leaders are providing that to staff, I mean, I think you will, I think people will respond to that because they will feel cared for. And you like may never ever know the impact that that has had on somebody. And I'm recalling an experience from an employee I had years ago with some leadership behavior that I frankly thought was not a big deal. But, you know, she was going through a difficult time with one of her children, kind of surrounding some behavioral health, mental health things. And I don't want to get into the details, but there were some very simple acts of like kindness and gestures that I didn't even know about how much of an impact they made on her actually until I moved on to my current role. And I went to this like leadership class, and people had to write stories about when they saw me at my best self. And she wrote this like story, and like to me it was just like being part of a decent human being. But I think I would, you know, I think we have to be with the staff, and one thing we can do is we can just like offer it up. And you know, you don't necessarily have to wait until the situation presents itself. You could just kind of put it out there. Hey, if people in the workplace are having it, you know, because staff aren't always going to come to the leader. They don't feel comfortable, but they're going to go to their coworker. Or maybe it's not so much an employee issue, but maybe, you know, my wife or my son or my daughter or what have you. Or, you know, maybe it's my neighbor, and I have no idea what type of insurance I have, but I can share the healthcare, that Howard County Health Department list, and maybe I can help my neighbor get them, you know. So it's kind of like, you know, you're casting the net wide, and you're just putting it out there, not necessarily, you know, proactively. And I think, you know, that will help people, because I think, like I said, to the extent you can be with the people and they see you as like, wow, like this person is very concerned about me. And it's more like, it goes away from like, oh, I'm the leader, you're the employee, to more like, no, we're in a relationship to each other and we care for each other and we're going to try and help them. So, and I think, you know, and it's the right thing to do. I mean, secondarily, you're going to get more productivity and more efficiency and all these words we like to hear in business. But we're all decent human beings, and we should be doing all that anyways, regardless of the secondary gain we're going to get for our business. So that's what I would offer.
Thank you. And excellent. And one thing I do want to just quickly shift back to Dr. Kolodner, because it was something I didn't want him to touch on before we wrap up. And that is, so obviously what John was just touching on was some of those, again, resources that you can give to show certainly that you've been, that you're supportive of your team. But at the same time, if you have to work as you deal with some of these challenges, COMAC has a program, I guess, that allows people to work and go to school while also in intensive outpatient care. And so if you would share a little bit about that, Dr. Kolodner, how that works and how you would actually treat a patient while they're working but still in a virtual setting.
Well, you know, when we got started back in the early 70s, there was this notion that the only way to really get into recovery was to do inpatient, because that's what had worked in the past. But we've been able to demonstrate, and other people have followed us, that you can do this in an outpatient setting. And so we've been doing that in an after-hours work for well, since 1973, and when COVID hit, we were able to shift that to an outpatient setting. So what we'll do is, and I mean to a virtual setting. So what happens is people will call the same emergency line or intake line that we've always had, but now when the intake person gets the call, they make a decision based on some questions that we ask the patients about whether this person is likely to be in withdrawal or not. If they're not likely to be in withdrawal, they get set up with with one of our general clinicians. If they are going to be in withdrawal, then we immediately alert one of our withdrawal management nurses, who calls the patient back within 30 minutes and walks them through, does a medical evaluation and walks through the process of, could this safely be done in a non-hospital environment? And we have criteria for that. And if the person does meet those criteria, what I do is I and our other medical staff will call in a prescription for the patient after we've determined that there is a reliable person in the house who will take responsibility for the medication. And we call in the prescription, and the patient or reliable person brings it home, and under the direction of our medical staff and the supervision of the responsible person, we monitor that person every hour and monitor the medication of it, the administration of the medication. And the protocols are so effective that we can stabilize people enough so they actually get into the rehab program that very first day. And that's, again, done in a virtual way. So that's the kind of transition in that we can do very expeditiously. We want to get people in treatment the very day that they call, rather than have them delay, because number one, people, especially when they're in withdrawal, it's dangerous to delay. But even if they're not in withdrawal, they're typically ambivalent about coming into treatment. And that ambivalence shifts, the window of opportunity opens and closes. So when it's opened, you really want to capitalize on that. Does that give you a brief summary of kind of the overview?
Yes, no, that was great. And so we've got, as we kind of get prepared to close, we've obviously tried to cover a ton of ground in a short period of time here. But one, I just wanted to ask perhaps Shireen if there's, I know there was a number of things mentioned earlier, but perhaps, and I think there's something that's next week that's taking place that you shared. If you would just, again, touch on, I think, what's being offered again next week that people can participate in. The other thing I'll just also comment on, I've had conversation with one of your colleagues and Kelly Kessler, who is over the Local Health Improvement Coalition for Howard County. And I know one of the things for those on the call that she has definitely tried to have more of is business involvement, so that truly the health department has that connectivity to the business community besides just working with not-for-profits, as well as those that are in the maybe mental health profession or what have you. But anything forthcoming that, again, you just want to share just as we prepare to close?
Sure, thank you again. Next week on the 27th from 11:30 to 12:30, we are hosting behavioral health in collaboration with the LHIC department at the health department, a WebEx on COVID-19 and special populations. And this time we're taking a look at the veterans and their caregivers. So that's the upcoming topic for the 27th, which is a Wednesday from 11:30 to 12:30. And if you go to the LHIC website that I shared, you can get additional information as to how to register for that upcoming event.
Excellent. Well, with that, I want to thank all of our panelists for joining us today and sharing these insights. I know that they would make themselves available to your companies or organizations should you need someone to speak more in depth, whether that is on treatment and how it can be done in a telehealth format from COMAC, or if it's, again, resources coming from the county's Department of Health or our hospital system, which is an affiliate of Johns Hopkins Medicine. But again, I want to thank all of you again for your participation. For those of you that have listened in, thank you for your continued support. Just a reminder, we will be back next week on Tuesday, the 26th, as well as also the 28th on Preparing to Open. We'll be focused on education, where we'll have our superintendent. Also, we'll have the president of Howard Community College, to name a few on the education side. And then we'll also be talking childcare, because again, that's going to be another issue, again, as workers, and particularly essential workers, try to continue working and others go back, and how we manage the whole childcare and education conundrum that we're facing. And then also for us on the 27th as well, but at 12:30, we'll have County Executive Ball, who will be with us and talking about preparing to open from a Howard County perspective, and again, perhaps talking about the approaches that he's taken and why certain things have been enacted and maybe not enacted, for those of you specifically that are wondering about why your business can't open or what have you. So all of these details can be found in the Chamber's website at howardchamber.com. Thank you all, and have a great afternoon, and be safe.
Thank you.